Thank you. I'm very pleased to be here this afternoon and have a chance to talk with you about some of the work that we do at the Wellesley Institute and how we believe that community-based research can be used to inform discussions and debates on health and social policy. So the Wellesley Institute is a Toronto-based think tank. We conduct research and policy issues, policy analysis on issues in population health around the social determinants of health. And we often work in collaboration with academic and community partners. The research that we rely on takes different forms. We conduct reviews of published evidence. We sometimes work with large data sets, the census, for example. And the strength of that kind of work is that we can look at large bodies of evidence across populations, and you can look at different points in time. We also conduct focused studies on specific policies, such as health impact assessments and health equity impact assessments. And these would look at how specific policies or programs might impact health in negative ways, with an emphasis on disadvantaged populations. And they might seek to understand who's disproportionately affected. And finally, we work in partnership with others on community studies. And these can be a mixture of approaches and methods, but they involve primary research with communities. So today what I'd like to touch on some of our work is some of the policy analysis and community research that I believe is grounded in community, but also helps to contribute to an understanding of the health and social impacts of social policies for immigrant and refugee populations. So at the Wellesley, we have a history of supporting and conducting community-based research. In the past, we offered training and funding in community-based research. Some of you may have remembered attending workshops at the Wellesley or applying for one of our grants. More recently, we've moved into policy analysis. And while community research and policy analysis can seem to be at odds with each other, what we've been trying to do is give shape to policy research that's informed by community research. We believe the strength of community research, that it can bring to the forefront the life experiences of people in different communities, can be used to shape a body of evidence on health and social issues that's locally defined and locally relevant. And in doing so can contribute to larger discussions about health and social issues in our society. Community research has the ability to create real links between broad-based public health evidence and local knowledge. We know that community information is often being gathered by service providers at the local level, and there are policy tools that can help to unify data as it's being gathered, which we believe we can tap into this information that's being gathered in pockets and communities across the province. In promoting community research, we are promoting research that's action-oriented. And this is work that capitalizes on a range of skills and expertise and is intent on gathering concrete information that can help to assess whether a policy is working or not, and if not, who is being affected and how. But we're very aware that community research comes with challenges. For some, it's viewed as too anecdotal and lacking methodological rigor. It's been critiqued for placing a greater emphasis on capacity building than on research, or that it ends up trying to turn community partners into researchers rather than to really draw on their knowledge and expertise. We know that community studies can feel disconnected. We still struggle with how to ensure that small projects that are taking place in different communities across the province are connected in meaningful ways. But we also know that good community research relies heavily on community agencies. And at the same time, we know that community partners are under a pressure to do more and more with less and less. And research is something that they often do off the side of their desk while tackling competing demands. These challenges that community research is often seen that quite detached from policy debates. It's somehow seen as interesting, but not regarded as playing a key contributing role in understanding public policy. And at the same time, we know that local information is vital. It can help us really understand the impact of social policies in the real world and help us shape some meaningful recommendations. And this is becoming increasingly important in a climate where funding is harder to get, especially for community-based agencies, and where evidence is increasingly politicized, where the evidence that's being used to shape policies and practice can seem distant from the experiences of communities. And official data sources, like the National Household Survey, are being questioned for their ability to tell the stories of the communities that we're part of and that we work with. So this afternoon, I just wanted to talk a little bit about a couple of research projects that we've been doing in partnership with community agencies, and why we think that there's a great value in reasserting the role of community research to inform policy analysis. I'm going to talk about two different examples. First, using a health equity impact assessment tool, and secondly, conducting a community action research project. A health equity impact assessment is a tool to analyze a new program or policy's impact on health disparities, and the disadvantage that some populations might experience. It relies on frontline information and data that's collected from healthcare providers and professionals who help to assess whether or not there's been an adverse effect to a policy that's been introduced. So many of you are already familiar with the Interim Federal Health Program, a temporary health insurance program that was available to refugees, protected persons, and refugee claimants in Canada. In 2012, the federal government brought into changes which effectively eliminated healthcare coverage for many refugees and refugee claimants. So prior to that happening, what we did was we did a predictive health equity impact assessment, and we considered what would be the effects if those cuts came in and who would be affected. And that first attempt to sort of predict what the cuts would do suggested that the cuts would have a profound impact on the health of refugees across the province. Following the cuts, because of course the government didn't take our recommendations to heart, the Canadian Doctors for Refugee Care worked with healthcare providers across the province to track the impacts of changes as a result of the IFH program through an online survey. Now that tool gathered important case information on health outcomes for refugees across the province. The data that was collected was really detailed. It included the severity of the issue and whether or not it could be avoided. And what we did at the Wellesley is we used this data in a policy-oriented health impact assessment. The findings confirmed that dramatic negative health impacts were a direct result of the cuts. We were able to show in concrete ways that people lacked access to primary health care and that they had limited access to and use of critical health care, even in medical emergencies. In July of this year, a federal court overturned the cuts to the Interim Federal Health Program, citing in its judgment the growing evidence regionally, provincially, and nationally. Many of that information was provided by community partners. And I think this research demonstrates the best idea of bridging community and policy research. It was timely, it relied on the expertise of community providers, and made use of a tool that looked at concrete impacts of policy changes. So the Health Equity Impact Assessment is a good illustration of a simple tool. But without the online survey where the frontline providers contributed information, our analysis would have been dismissed as speculative or anecdotal, and it would have been a missed opportunity. We know that gathering community-level data is not always easy, and sometimes the data are not being collected. But we also know that policies are being shaped and revised without real input from community members. And in this situation, what we need to do is we need to gather frontline primary data. This is something that we're trying to do here in Toronto on a project called Migrant Workers Speak. It's an action research project that we're doing with the Migrant Workers Alliance for Change. And what we're doing is we're looking at the health, employment, and social impacts for workers who are here under the Temporary Foreign Worker Program. So there's significant changes that are taking place in the Temporary Foreign Worker Program, and we know that there's pockets of work that's being done across the province, but there's still limited information from the workers themselves about their experiences. And so we thought it was urgent to try and do some timely research where we could hear from people themselves. So this project emphasizes an action research approach. And so it involves a collaborative decision-making process between team members representing MWAC and those of us at the Wellesley Institute. And each step of the way has been a process of teamwork and negotiation. We developed the research design together, we did ethics together, we constructed the interview guide and the survey tool, and we're currently collecting data. And as you would expect with a project like this, it takes more time and commitment. It requires that partners play an active role and that we each contribute particular skills and expertise. Well, why this project stands out for me is that we've put collaboration and action at the heart of the project, where community partners are actively shaping the work and where the goal is to bring migrant workers' perspectives to the forefront of discussions. This is not about capacity building, although I think it's fair to say that all of the partners involved have learned new things in the process. This is about gathering research information for action and change. And in this type of research, it really relies on frank discussions on what the community partners hope to achieve. We may have shared goals and interests, but there also may be ones that are specific to our institutions. And on projects like this, it really relies on trust among the team that we're going to be faithful to the shared goals of the project and that nobody's going to be pushing their agenda out first. And that we ultimately maintain the integrity of the work by staying true to the stories that we hear. These two projects, the Health Equity Impact Assessment and the Action Research Study, demonstrate two different ways that community research can contribute to policy analysis and ultimately inform policy discussions or debates. But with any work like this, we need to always ask, how can we ensure that this work asserts the value of local data and contributes to policy analysis in concrete and defendable ways? And in linking community and policy research, how can we ensure that knowledge mobilization for frontline practice does not get overlooked? Policy changes can be ambitious goals, and sometimes research can point to knowledge gaps and different needs that exist on the front line, and we need to make sure that we don't lose sight of this. Research that is grounded in the communities that we work with and are part of has untapped potential in policy research, and it's often underused in situations where timely evidence is needed to inform analysis and make recommendations for change. We see great value in bringing together the worlds of community and policy research. In our experience, partnership approaches are critical to producing community research that can inform policy. It allows us to work across communities, and we can draw on different expertise and tools to gather concrete and meaningful data. Community-generated evidence is especially critical in situations where health and social policy may be more driven by ideology than by evidence. And the evidence may not be perfect, but it can tell a story that can challenge the credibility of policies that are not evidence-based, and in doing so ensures that we have a voice in policy discussions. Thank you.